In this video tutorial, I am going to discuss this exam question that why gout causes pain in the first metatarsophalangeal joint. Gout is one of the most painful forms of arthritis, and when it strikes, it almost always targets the first metatarsophalangeal joint, or you can say base of the big toe, a condition called Podagra. Why this joint? Why not knees or the elbows or the fingers? Today we are going to explore the fascinating science behind why gout has a favorite spot and what makes this pain so uniquely intense. To understand why the big toe is affected, we first need to understand what gout actually is. Gout is a metabolic disease that starts with something called hyperuricemia. That means too much uric acid in the blood. Uric acid is a normal waste product that comes from the breakdown of urines. Normally, uric acid dissolves in the blood and is excreted by the kidneys. But when level gets too high, the uric acid can't stay dissolved. When uric acid exceeds its solubility limit, it crystallizes into sharp needle-like structure called monosodium urate crystals, or you can say MSU crystals. These crystals deposit in joints, and that's where the trouble begins. Now these crystals aren't just sitting there quietly. The body sees them as a foreign invader. So immune cells called neutrophils and macrophages rush to the sites and try to engulf these crystals through the process called phagocytosis. But here is the problem. These crystals are sharp, so damage the immune cells from the inside. This leads to release of a powerful inflammatory molecules called interleukin-1 beta, which leads to inflammation. This inflammatory cascade causes the classical signs of gout attack: intense pain, redness, swelling, and warmth of the joint. The pain can be so severe that patients describe it as one of the worst pain they have ever felt. So, we know how gout causes inflammation, but still doesn't answer the main question. Why does it love the big toe, or you can say first metatarsophalangeal joint, so much? It turns out there are three main reasons. Low temperature. The big toe is one of the coolest part of the body because it's far from the core and has a less blood flow. And here is the crucial point. Uric acid is less soluble in cooler temperature. That means crystals form more easily in the big toe than in a warmer joint close to the core of the body. The second reason is mechanical stress. The first metatarsophalangeal joint, the base of the big toe, bears a tremendous amount of weight during walking and standing. Every step creates a micro trauma in this joint, and that repeated trauma makes it easier for the crystal to deposit and trigger inflammation. And third reason is synovial environment. Joints are filled with a lubricating fluid called a synovial fluid. In the first metatarsophalangeal joint, there is less synovial fluid turnover compared to larger joints. This means once urate crystals deposit here, they are not easily washed away. They accumulate over time, making this joint a hot spot for repeated attacks. When all these factors combine, the result is Podagra, that is a gout attack in a big toe. The pain is excruciating in nature, comes on suddenly, usually at night, and within hours it reaches at the peak intensity. The joints become so swollen and tender that even the slightest touch, like a bed sheet brushing against it, can be unbearable. The skin over joint turns red and shiny, and without treatment, this can last for days. The attack may resolve on its own after a few days to a week. But if the underlying hyperuricemia is not managed, the attack will come back. Over time, repeated attacks can lead to chronic gouty arthritis and the formation of tophi. Tophi is a hard lump of urate crystal under the skin. Now, there is one more fascinating detail about gout that I want to share with you. And this is something patients often notice but don't understand. Gout attacks have a strange tendency to strike at night. Let me explain why this happens. Many patients report waking up in the middle of night with sudden excruciating pain in their big toe. This isn't a coincidence. There are specific physiological changes that happen during sleep that makes gout attack more likely. The first reason is body temperature. During sleep, especially in the early morning hours, the body's core temperature drops. And remember what I said earlier, uric acid is less soluble at lower temperature. So as the body cools down, the conditions become even more favorable for crystal formation in that already cool big toe. The second reason is mild dehydration. Throughout the night, the body loses water through the breathing and sweating. But there is no water intake to replace it. This mild dehydration concentrates the blood, which means the uric acid becomes more concentrated as well. Higher concentration means it's easier to exceed the solubility threshold and form crystals. There is also a third factor, that is cortisol level. Cortisol is a natural anti-inflammatory hormone that peaks in early morning. But during the night, cortisol levels are at their lowest. This means the body's natural brake on inflammation is reduced, making it easier for the inflammatory response to spiral out of control when those crystals form. So when you combine cooler temperature, concentrated uric acid from dehydration and reduced cortisol, all happening simultaneously during sleep, you get the perfect condition for crystal formation and an acute inflammatory attack. That's why patients so often wakes up in agony in the middle of night. So to summarize, gout causes pain in the big toe because of the perfect combination of factors. The joint is cool, which favors crystal formation. It experiences mechanical stress, which promotes deposition of crystal, and the joint environment doesn't clear crystal efficiently. All of this makes the first metatarsophalangeal joint the number one target for gout. So this completes our discussion for this video. I hope that all the concepts are clear. If you still have any query or confusion, please write it down in the comment section below. Thank you.